Today on the podcast, culture change in nursing homes. What does that mean, and what does that mean for the quality of life of nursing home residents? The Nursing Home Abuse Podcast is dedicated to providing news and information for families whose loved ones have been injured in a nursing home. Here are your hosts, Georgia attorneys Rob Schenk and Will Smith. Hey out there, welcome back to the podcast. My name is Rob. I will be your host. For this episode, we're going to be talking all about culture change, what culture change means, and how that impacts the lives of residents of nursing homes across the country. Before we get into it, a simple ask, that is, please, if you are enjoying the content of these episodes, like and subscribe wherever you get your podcast from. Then check out our YouTube channel with the Nursing Home Abuse Podcast YouTube channel. Like and subscribe there. If you want us to talk about a specific topic, let us know. Shoot us an email, leave a comment. Let us know somehow. Smoke signals, doesn't matter. We will attempt to get to every single one of your suggestions. In fact, many of our upcoming episodes come to us from listener suggestions. So with that out of the way, let's talk about what the topic of the show is, and that is culture change in nursing homes. But we're not doing that alone. We have a guest this week. Her name is Carmen Bowmen. Carmen Bowmen is a consultant, trainer, author, and owner of Educatering, catering education for compliance and culture change, turning her former role of regulator into educator. Carmen was a Colorado state surveyor and inspector and policy analyst with the federal government Division of Nursing Homes of CMS, where she taught the National Basic Surveyor course. She has been a part of many national culture change projects with CMS, the Pioneer Network National Culture Change Organization. She has a master's degree in healthcare systems, a bachelor's in social work, and German. Sprechen Sie Deutsch, Carmen. She co-founded the Colorado Culture Change Coalition and has authored 8 culture change workbooks, plus hosts a monthly web culture change talk show, Conversations with Carmen. Her passion is to share the inexpensive, common sense, better practices of culture change with anyone who will listen, and hopefully many of you out there will be listening as we have Carmen on the show. Carmen, welcome to the show.
Thank you. Thanks for having me, Rob.
Now, we talked a little bit at the top about your background as a surveyor. We didn't talk about what exactly culture change is. So from a broad standpoint, Carmen, what do you mean when you say culture change in nursing homes?
Yeah, thank you. Sometimes I'll just be honest, people, it's natural. We get confused with the word culture. And oddly enough, some people think ethnic culture right away. They get a little stuck on that. So I'm glad you asked because, let's just get that out of the way. Obviously, we can't change someone's ethnic culture. So if your brain went there, it really means institutional culture. And so in a way, we should have put that in the title because it can be confusing. But I think everybody knows what we're talking about when we say institutional culture. It doesn't take long for people to say, oh my goodness, yes. That means that you kind of lose who you are. It's not your schedule anymore. It's the institutional schedule. You are told when to do what, you are not given a lot of choice. So guess what culture change means? Changing institutional culture to actually create home. By the way, we don't say home like, even though you will hear that terminology. Who wants home like? I don't want home like. I want home. I want true home. And it's a big ticket, everybody, because, if it's your home, guess what? You're making the decisions. And many of you listening go, whoa, my mom and dad, they are not making the decisions. I know. But that's why we have a movement. And we have leaders in the movement who can show us how they do it. So for instance, there's a home in Denver that involves residents and team members. I don't use the word staff. It's kind of institutional. I love the word team member. And so the people who work there and the people who live there are all involved in making decisions, true decisions about the place, such as what juice to buy. They're sampling. How much does this one cost? How much does this one cost? We have homes in Illinois where residents are actually involved in hiring the people who are going to take care of them. There's a resident hiring committee, and you have to pass that committee in order to work there. And so I just need people to hear across the country, these things are actually happening. You are not woken up on the institutional schedule. Instead, we recognize that how important sleep is. Why would we wake you up? Your body should decide when to wake up. How many of us love getting to sleep until our body has had enough? Isn't that amazing? And I'll just say a few more things, Rob, and then you react, okay? But it's your body that decides when to wake. We have open dining, so you can dine when you want to, when you're hungry. That might be early, that might be late, that might not be any breakfast at all, right? We have also more like we have changed environments. Maybe some of you have heard. We're building nursing homes to look like a house, believe it or not. They're called the greenhouses or small houses. We also have a model called the household model. And so you live in a house and you have a private home, and there's the dining room and there's the kitchen. You could actually go in because why? It's your home and it's your kitchen. So just a smattering right there.
So thank you for that. And if I understand correctly, Carmen, the institutional culture change is, if I understand it correctly, not necessarily the changes that the resident has to go through from being independent or living on their own and then going to long-term care. It's the approach that long-term care takes to the resident.
Yes.
In order to make the resident feel at home. Maybe that's not even the right word. As you said, it's not home-like. That is the home. So right. Institutional culture change is making the facility, the institution of long-term care, a home. Is that, did I understand that correctly?
Yes. And the good news is it can be in any type of building. You don't have to redesign the building. You can create true home in an old institutional building.
I understand. And by way of example, you mentioned that from an institutional standpoint, facilities generally will hire staff based on whatever training they have, based on the interviews with the administrator or human resources or whatever the case may be, leaving the residents out of it. However, applying culture change and to the institution, making it more of a home,
yes.
You mentioned that there is at least one facility that allows the residents to kind of do the interview. So that's an example of culture change. I think I understand that, because at first I was confused, like, okay, it's culture change. The resident comes into this place and it's no longer their home. No, it's the approach the long-term care facility takes to the resident to make it a home. So that was the residents interviewing the potential staff, potential team member, referring to the team as team versus staff.
Yep.
But what are some other examples from an institution, from a facility-wide standpoint, of culture change? Like, how can that be approached from a cultural or from a institutional level?
Sure. Oh, there's so much, Rob, that we can talk about. One reaction I'm having to your question is not to correct you, but another example is to stop calling it facility. You know, here's what has helped me, and I want to help everyone listening. If you think of a home, would you ever call it a facility? Isn't that something? We all live in homes. We call it a home. Now, sadly, many of these places do look like an institution. I have people kind of joke back and say, Carmen, it is a facility, you know, but here's the point. In real life, real people don't live in facilities. It's not a word we use. And this has also helped me. So what is a facility? It's like where the buses are parked, or it's even a school, everybody. Why? Because nobody lives there. It's a facility. It truly is. And so even though we're used to saying it, Rob, you're used to saying it, it's even though it's in the regulations, guess what? We don't have to use it. And to be honest, the more you use more normal language, the more you will create a culture change, because you will, every time you say an institutional word, you promote the institution. Every time you take a breath and you choose to say a better, less non-institutional word, you create a better home. Isn't that cool? So you can trade out facility for the word home and the word community. We love the word community in this movement because I think it's a good word. If you think about it, even one small nursing home unto itself is a community. It's a fair word. Now, sometimes you might talk about the community at large, the town you live in, but you could use that lingo. And then it gets even better. Instead of unit, we've traded it out for the word neighborhood. If you think about it, neighborhood fits community, fits the language of home. And we even have homes in Colorado where the people who live there, we could talk about not calling them residents, the people who live there chose to be called and call themselves neighbors. So neighbors live in neighborhoods, live in communities, live in homes. And now, guess what? This is so, I'm sorry, but disgusting to me. When someone moves into a nursing home, they're often referred to as the new admit. Think about that. If you trade it out for neighbor, now you're the new neighbor. Woo! Isn't that good?
That's fantastic, and I'm never above reproach with regard to the words I use. I mean, like, I've learned so much in the 5, 6, 7 years that I've been doing this.
Sure.
You know, I completely understand going like,
Yep.
you know, everything from cognitive impairment to, you know, these type of things that, you know, you might not say anymore. So I appreciate that. That makes
Of
a lot of
course.
sense.
Yep.
In fact, I recorded an episode. We record a lot of episodes at once, and they go out in the future. And one of the episodes coming up is about the concept of accidents under the federal regulations. And as a member of the plaintiffs bar, we discourage the use of the word accident because most people attribute that most people, when they use the word accident, they're saying no one is at fault.
Mm.
So the term accident, that's why it needs the moniker of avoidable or unavoidable in the federal regulations to go around that. So I typically don't like saying accident for that reason. So we need to educate people that, you know, the same thing. So anyway,
thank you. Yep.
So
You're right.
if I understand correctly, then the one of the ways that a nursing home, that a community, that a neighborhood may implement culture change is the use of words.
That's right.
That's an institutional thing that the team members can put in place and change their documentation. So the face sheet may read, instead of facility, it would read, you know, this is whatever of Twin Oaks neighborhood, not unit, but this particular neighborhood alpha, or not even alpha. I mean, maybe too clinical. Neighborhood, you know, tall tree. I don't know.
Well, guess what? Like, I always use this one, Rob. Aspen neighborhood. I'm from Colorado. We tend to glom onto words from our area.
Sure.
So you're right. Tall tree, elm neighborhood, whatever.
There you go. So that makes sense. And can you tell me, Carmen, in your experience and your anecdotal research into this, what are the benefits of these type of changes, this type of approach to long-term care? Like, what effect does this language have on the resident? Like, how is that good or bad for them?
Okay. Well, keep in mind, we're starting with language here, everybody. And language, I do like to point out, is powerful and it costs no money. Isn't that cool? We can all change our language and then just watch what it does to the culture. However, that's just words. You know, now take it to the next step. If we call it a home, ideally we treat it as their home, like we've said, right? Here's a sad example. A lot of designers fly in from out of state and they decide how to upgrade the decor, and then they fly home. That is not home to the people who live there. See, the people who live there would be deciding what decor they want. So it's one thing to change language, and that's very, very good. But it's also an important step to make it true home, not just semantics, right? And then as you keep doing this, changing institutional culture, so it's more of a home and less of an institution, the outcomes, like you're asking for, are so good. Let's say I live in a nursing home and I start to say, you're not going to believe this place. First of all, they don't wake me up. They honor sleep. I'm so rested, finally. Guess what happens when people are well rested? Their health is better. There's less depression, less anxiousness. For heaven's sake, we call ourselves healthcare. It's kind of a lie because we wake people up on the institutional schedule. We wake them up all night long. We could talk about that, to check and change. We treat people very generically and institutionally, okay? We're supposed to treat people individually. And then, oh my gosh, you're not going to believe this place. You can eat when you want. I don't have to be in the dining room by a certain time. That's why they can honor my sleep, right? By the way, we don't say, let me sleep. We don't say allow. Not to pick on you, Rob, it came out of your mouth a little bit ago. It's very common. And here's some good news, everybody. You know, I don't allow you to do things. You don't allow me to do things. Adults don't allow. And so we support the people who live there to make those decisions, or we support sleep. And then we honor choice by giving these open dining times. You can dine, you know, the dining room's open from this hour to this hour, or better yet, we have 24-hour dining. We have homes that have realized, well, I have a kitchen, I have staff that make food. You give residents what they want when they want it. Isn't that cool? That is what we could have, everyone. So now you have very satisfied, healthy people living there. And then, Rob, it gets even better. Most people want to work in that kind of environment. So you have higher retention, you have better longevity, you have people who are satisfied, not calling the health department with those complaints or the ombudsman. You know, when ombudsmen are asked, where should mom live? Well, you might want to check out this home. You know, like, think all the outcomes are positive. You're going to save money when you honor people's natural routines and you don't make them do stuff. You're going to save money with less turnover. You're going to make money because a nursing home makes money when people want to live there and they're full. And you're going to have better regulatory compliance. So it's all there.
So if I understand correctly, there are several benefits to addressing culture change in a nursing home. At least one of them being that your team will be more likely to respect the dignity of the residents, and when the dignity of a resident of a person that lives there is respected, they're more likely to have positive health outcomes.
That's right.
I completely agree with that. I was investigating a case a few months ago where there was no culture change. This was facility with a capital F.
Yeah.
And they were cited for immediate jeopardy on several things. But one of the things that was not immediate jeopardy, they were cited for the use of language. And they were, which is rare in what I've seen, but it reflects the type of training the people in this place were receiving. The staff with the capital S, not a team. And it was a matter of in front of the surveyor.
Yeah. One
registered nurse who was training, I believe a couple CNAs in front of the residents, in front of the people that lived there. This was their home. Said, well, these are the feeders. These are these are the ones that maybe can do it on their own, like referring to people as feeders or non-feeders in front of them, to their faces. And that was that they were cited for that. And to me, that reflects that not only the care that's provided by them, but like what does that do to the dignity of the person that's standing there and has to hear that they are reduced to being a quote unquote feeder. So I completely understand where you're coming from. As you know, obviously there are many things that make culture change, but language being, as you mentioned, free, but so important to the dignity of these people, which in effect has an effect on the positive outcomes of people. What is your, obviously, I mean, I don't know, like in your experience, how widespread this concept is. Like, I don't know if the places that I deal with in Georgia aren't embracing this. What is your understanding of how far we've come with these concepts?
Yeah, well, I have bad news there. Sadly, our 20+ year movement has not taken a hold, as you can see. And here's some evidence that it's probably going backwards. We used to have 43 state culture change coalitions. I actually am a co-founder of the Colorado Culture Change Coalition. They have various names. We used to have 43. Right now, the last count I heard was 30. So that just is some evidence. So the bad news is maybe it's taken a step back. It hasn't grown like it could have. And what we also see there is the administrators that were dedicated to it, they retired. Or the companies, the small companies that were doing it, they got taken over by the big company, right? And so guess what happens when those things happen, right? But the good news is we have 20 years evidence that this is better. And thank you, Rob. Perhaps moments like these on podcasts like these, where who knows who's listening, can jump on the bandwagon. I have good news for Georgia. There is a Georgia Culture Change Coalition that is trying desperately to make waves and make this happen in that state. You could hook up with them. I could connect you. And anyone listening from that state, be aware of that. But, to a general listener, I get excited because, we're Americans. Isn't there a way to figure out how any of us can help make this happen? So for instance, you're looking for a nursing home. You ask some of these questions. Hey, do you wake people up in the morning? Just see what they say. The institutional nursing home is going to say, oh, of course we do. Because it's like the thing to do, right? And you're like, oh, I don't think that's going to work for my mom. Maybe ask the next one, Now, sadly, maybe they all say we wake up my mom. And that's the hard part. But the more we ask the right questions, oh, that's not going to work for my mom. Well, what do you mean? Well, she needs her sleep. We don't want her woken up. She doesn't want woken up. And then see what they say, maybe they say, well, we can make that work. That's what you want, right? At least maybe we can make that work. But then the culture change answer would be, oh my goodness, no, we don't wake anyone up. Why would we do that? It's fun to hear that answer. That's a good place, for instance.
Right. Okay. So we've dealt in the past, we've had episodes regarding personal representatives, generally family members that have some type of authorization to act on behalf of their loved ones that are in nursing homes because maybe they aren't able to do so themselves. So that's something I heard you say that's very important, that you ask questions, culture change questions.
There you go.
That being, yes. What do you, if I move, if my mother decides to come here and live here, will you wake her up in the morning? That's a threshold question, right?
Yes.
What are some other things that family members can do to figure out the level of culture in that particular nursing home?
That's right. So, don't worry, everybody, if you don't have a list. Just kind of think, what would you really want for yourself or your mom? And then just turn into a question. So we want choice. Do you offer a menu at meals? See what they say. Do you have ways for people who live there to make decisions? Okay, both about their life, how they run their daily life, to decisions about the budget, like I was saying. So just turn what you hope for into the question. And it's kind of the opposite of what we typically see, right, in the institution. So I don't want anyone to panic. Just challenge yourself to get at some good questions. Another thing I've heard people do is with our pandemic, it's hard, you can't really do this now, but let's say you talk to the people who live there already, right? Are you given decision-making power in any way? Do you really get to decide when to take your bath or shower? Do you really get to decide when to go eat? Just try to get some true information.
That makes sense. And I would say that education on the family member's part on what culture change is equally important, because you say ask questions, but I would say that a lot of my clients, that's not intuitive. I think that in my clients' head, they want a hospital setting because that's what's going to keep mom safe, right? Like
could be.
As a home. So I think that's interesting. Are there any resources on your website that a family member can go to learn about culture change
Absolutely.
and like in that concept? I know it seems, easy as we talk about it, but that might not have dawned on somebody like, what, like I'm going to put my mom's dignity first versus, her clinical condition when searching for a nursing home.
Good. Well, I happen to have some articles on my website where I wrote to the general public for a small newspaper where I used to live. So I'm happy to say I do actually have some resources there. And then just do some internet searching on culture change. In your state, is there a coalition? The Georgia coalition actually has a number of very short videos that they've made recently. And it's meant for all of us, the general public, as well as people working in nursing homes. So go check those out.
And we'll have those in the show notes. We'll have both
Good.
Carmen's website and the Georgia Culture Change Coalition website in the show notes.
And two more resources, the largest groups representing culture change. One is called the Pioneer Network, so that's pioneernetwork.net. And the other one is called the Eden Alternative, edenalt.org. Oh, and then there's another one I mentioned, the greenhouses, the small homes. That's the Greenhouse Project. Oh, and I mentioned households, and the leading group there is Action Pact, PACT.com.
And what was that first one? Pioneer
Network.
Pioneer Network. Okay.
Like they're pioneers in this movement. Yep, that's right.
Very good. Well, Carmen, we really appreciate, this is a lot to unpack and a lot to think about. So we appreciate you coming on and sharing your experience with us regarding culture change. And I think we have a lot of good information for our audience to a lot of actionable items for our audience today. So we really appreciate you coming on.
You bet. Thanks for having me.
Thank you. I learned so much hosting this podcast. I am never above being corrected on my use of language. I agree that language is absolutely powerful, and we should be careful when using particular words. And so I'm so happy that Carmen was able to educate me on my use of these words and how they relate to culture change. So many things I learn. I am humbled every other week as this podcast comes out. So you can, as I mentioned, you can catch new episodes every other week, 2 times a month, as it were, on Mondays. If you're enjoying the content of these episodes, let us know. Like and subscribe, leave a review, check out our YouTube channel, check out the links that Carmen mentioned this week, and get active in your local culture change coalition. I know that I am. And with that, folks, we'll see you next time.
Thanks for tuning in to the Nursing Home Abuse Podcast. Nothing said in this podcast, either by the host or the guest, should be construed as legal advice, nor is intended to create an attorney-client relationship between the host or their guest and the listener. New episodes are available every Monday on Spotify, iTunes, Stitcher, or on your favorite podcast app, as well as on YouTube and our website, nursinghomeabusepodcast.com. Again, that's nursinghomeabusepodcast.com. See you next time.